Do you know what meningitis is and how it affects our health? Meningitis, a term that may sound complex, is actually quite straightforward to understand. It refers to an inflammation that occurs in the brain and spinal cord membranes. This inflammation can create a whole host of health problems, some minor, others quite severe. But what causes meningitis? You may be surprised to know it's not just one culprit, but several. Meningitis can be caused by bacteria, viruses, fungi, parasites, or even a microorganism named Naegleria fowleri. Each cause brings its own set of challenges, and the severity of the disease can vary greatly depending on the cause. For instance, bacterial meningitis is severe and calls for immediate medical attention, while viral meningitis is usually less severe, often resolving on its own. In the next few minutes, we will dive deeper into understanding meningitis, its causes, symptoms, and types. Now, you might be wondering, what causes meningitis? Meningitis, as we've mentioned, is an inflammation of the brain and spinal cord membranes. But what triggers this inflammation? The answer lies in a range of culprits, including bacteria, viruses, fungi, parasites, and a microorganism called Naegleria fowleri. Bacterial meningitis is a particularly severe form of the disease, most often caused by bacteria like Neisseria meningitidis. This type of meningitis can have serious consequences if not treated quickly. It's crucial to seek immediate medical attention if bacterial meningitis is suspected. But not all meningitis is bacterial. Viral meningitis, while still a serious condition, is usually less severe and most often resolves on its own over time. It's typically caused by a group of viruses known as enteroviruses, which are most common in late summer and early fall. Then there's fungal meningitis, a form that's less common and usually affects individuals with certain medical conditions or weakened immune systems. It's caused by a fungus that spreads through the bloodstream to the spinal cord. Parasitic meningitis, on the other hand, is even less common. It's usually caused by parasites like the one called Naegleria fowleri. This amoeba is typically found in warm freshwater environments and can cause a devastating infection known as primary amoebic meningoencephalitis. Each of these causes of meningitis presents a different level of risk and severity, but they all have one thing in common. They can lead to inflammation of the protective membranes around the brain and spinal cord, causing the condition we know as meningitis. Thus, understanding these causes is the first step towards prevention. So what are the symptoms that indicate someone might have meningitis, you might ask? Well, it's important to note that the symptoms of meningitis can vary greatly depending on the cause, and they can appear in any order. However, some symptoms are more common than others and can serve as red flags. One of the most common symptoms is a high fever. This is usually one of the first signs that something may be amiss. The fever can come on suddenly, or it can gradually increase over a few days. It's often accompanied by a feeling of being generally unwell, similar to the flu. Another common symptom is a severe headache. Unlike the typical tension headache or migraine, this kind of headache is often described as being different from normal, more intense and persistent. It's not the sort of headache that goes away with a simple, over-the-counter painkiller. Next on the list is a stiff neck. This isn't just a minor crick in the neck that you might get from sleeping in an odd position. It's a significant stiffness that makes it difficult to touch your chin to your chest. This symptom is often accompanied by sensitivity to light, also known as photophobia. Other symptoms can include nausea or vomiting, confusion or difficulty concentrating, and even seizures in some severe cases. Children and infants may show different symptoms, like being irritable, having a high-pitched cry, or refusing to eat. Remember, the symptoms can appear in any order, and some may not appear at all. It's also possible to have meningitis without a fever, especially in the early stages. But here's the key takeaway. If you or someone you know is experiencing these symptoms, especially fever, severe headache, and a stiff neck, seek medical attention immediately. Meningitis is a medical emergency. The sooner it's diagnosed and treated, the better the outcomes are likely to be. Recognizing these symptoms early can lead to immediate treatment and increases the chances of recovery. So, be vigilant, be aware, and take action when necessary. Meningitis isn't just one disease, but several, each caused by different organisms. Let's dive into the different types of meningitis, which include bacterial, viral, fungal, parasitic, and meningococcal disease. Each type varies in its severity and treatment. Firstly, bacterial meningitis is a severe form of the disease that requires immediate medical attention. It's caused by various bacteria, one of which is Neisseria meningitidis. This strain of bacteria not only causes meningitis, but can also lead to bloodstream infections, referred to as meningococcal disease. Vaccines are available to prevent some types of bacterial meningitis. Next, we have viral meningitis, which is usually less severe than its bacterial counterpart. Most cases of viral meningitis resolve on their own without treatment. However, it's essential to seek medical advice as the symptoms are similar to those of bacterial meningitis. Fungal meningitis is a rarer form of the disease. It tends to affect individuals with certain medical conditions or weakened immune systems. It is often contracted by inhaling fungal spores from the environment. Treatment typically involves long courses of high-dose antifungal medications. Then there's parasitic meningitis, another less common type, caused by parasites. It's typically contracted through contact with contaminated water, soil, or certain infected animals. This form of meningitis can be severe, but it's also preventable and treatable. Finally, we come to meningococcal disease, a serious infection caused by the bacterium Neisseria meningitidis. This can lead to meningitis and also severe bloodstream infections. It's particularly dangerous because it can progress rapidly, so immediate medical attention is vital. Vaccination is the most effective way to protect against this disease. Understanding these types can help us better protect ourselves and our loved ones. So, how can we prevent and treat meningitis? To answer this question, we need to first understand the importance of vaccines in the prevention of certain types of meningitis. Vaccines are a powerful tool in our fight against this disease. They work by preparing our immune system to recognize and fight off specific bacteria or viruses. In the case of meningitis, there are vaccines available that can protect against some of the bacteria and viruses that cause it. These include vaccines for meningococcal disease, pneumococcal disease, and Haemophilus influenzae type B disease. By getting vaccinated, we can significantly lower our chances of contracting these types of meningitis. Now, what about treatment? The treatment for meningitis depends on its cause. Bacterial meningitis, which is severe, requires immediate medical attention. It's usually treated with intravenous antibiotics and sometimes antiviral medications. The quicker the treatment starts, the better the outcome. On the other hand, viral meningitis, which is less severe, often resolves on its own without specific treatment. However, it's still important to seek medical advice if symptoms arise. Fungal meningitis is a rare form, often seen in individuals with certain medical conditions. It's treated with antifungal medications. Parasitic meningitis, less common, requires specific antiparasitic treatment. Remember, it's crucial to seek medical help at the earliest sign of meningitis symptoms. Early diagnosis and treatment can save lives and prevent serious complications. In conclusion, prevention of meningitis is best achieved through vaccination, and treatment varies depending on the cause. Maintaining a high level of hygiene, like regular hand washing, can also help prevent the spread of viruses and bacteria that can lead to meningitis. With the right knowledge and precautions, we can significantly reduce the risk of meningitis. Now that we've learned about meningitis, its causes, symptoms, and types, let's recap what we've discussed. Meningitis is an inflammation of the brain and spinal cord membranes that can be caused by various agents, such as bacteria, viruses, fungi, parasites, or Naegleria fowleri. The severity of this disease can vary, with bacterial meningitis being the most severe and requiring immediate medical attention. The symptoms can include fever, headache, and stiff neck, among others. There are various types of meningitis, including bacterial, viral, fungal, and parasitic, with bacterial and viral being the most common. We also discussed the importance of prevention and treatment, with vaccines being a key method of prevention for certain types of bacterial meningitis. Lastly, we emphasized the importance of seeking immediate medical attention if you or someone around you exhibits symptoms of this disease. Remember, knowledge is power. The more you know about meningitis, the better equipped you are to protect your health and the health of those around you.